Well, once a month, we get the opportunity to hear from someone in our congregation share what they're going to be doing this time tomorrow. I'm privileged to have joining us today Ife Ojo. Ife is a medical doctor, he's a pediatrician, and he's done a lot of great thinking, theological thinking, on how he connects his faith and his work. So, Ife, thank you for joining us. My first question to you is, what do you do? What does a typical day look like for you as a pediatrician, one who serves kids?
My day as a pediatrician basically involves clinical work in the outpatient setting. For the most part, I work in two outpatient clinics associated with Hennepin Healthcare. And most of my work involves coming alongside families to answer questions, provide some suggestions and tips, and also offer vaccinations to help babies and young children and young adolescents stay healthy. In addition to my work as a pediatrician, I teach a course for medical students in their first and second years at the University of Minnesota, and I help them connect their clinical thinking with the basic medical sciences that they are currently doing in most of their other classes.
Well, Ife, as an image bearer, how do you see your work as participating in what God is already doing?
I view my job as an image bearer of God as one that enables me to relate with people in the clinical setting and display God's love in my interaction with my patients, with their family members, my co-workers, and the residents and students that I have the privilege of working with. I believe that ultimately God uses this relationship that I have with people to express His love to them, and I try to engage through this mindset. I would confess that I'm not always perfect with this, and there are times I feel I've not done a good job with representing what exactly I felt like I needed to do in the moment. But thank God for His grace. I seek forgiveness from people when it's appropriate, and ultimately look to God to help me do better in the next situation that I'm faced with.
As we think about whole life discipleship, how do you see your work as an opportunity to love your neighbor?
I feel like working in the clinical setting gives me an opportunity that not too many people have. I just see my role as one who can come alongside a patient or family member or my co-workers to provide the best possible care that I can within my knowledge, experience, and with the resources that are available. I am grateful that the health system I work with provides care to a lot of underserved and minority groups. And we also have people that have a lot of resources available to them. So I feel like it's a level playing field for everybody where I work. In recent times, there's been an awakening in society, in Minnesota specifically, with about the differences in health outcomes that arise from racial inequity. And this has caused me to think about how I can better engage with my patients and understand where they are coming from, because I felt before now I may have been insulating myself from the lived experience of some of the families that I see in clinic. So I'm trying to do a better job of listening and then being able to address them in a way that would be more loving and in a way that would represent what God would have me do.
Well, great. Thank you, Ife, and thank you for sharing. Thank you for what you do. It really is it's an honor and privilege to be able to do this interview, and we certainly appreciate the way that you serve our community.
Thank you, Tucker. I am grateful that I am able to do this, and I appreciate being a part of Calvary Church and the community that we have there, even though we are quite distant right now. But thank you for this opportunity to be able to share with the congregation.